Good evening, dear students. We'll be starting today's topic is on cone beam computed tomography, the anatomy. And by now, after reading and going through the previous chapters, we know what are the landmarks in the head and neck, the radiographic anatomy. So now we will be learning as to how to visualize that in the different sections or in the different slices of the CBCT scan. Okay. I have included a bit of a theory part. After that, I have included certain sections for us to learn how to identify the landmarks also. Okay, let us go into the chapter now. See, CBCT imaging is an advanced imaging modality that provides excellent visualization of the dental hard tissues and osseous structures in 3 dimensions. The anatomic coverage of CBCT imaging may be limited to dentoalveolar arch or may extend to encompass a large part of the craniofacial skeleton. Okay, so basically, these are the 3 sections in which a CBCT scan can be viewed. That is axial, something which you see from the top view. Okay, coronal and sagittal. Okay, keep this in mind because all the structures, how they are going to appear in other sections or each section is basically dependent on these 3 main part. Okay, now. So when you have a CBCT, the volume is acquisited, then the volume is prepared, and you have the final image. You have to interpret it and give the report. So what are the general principles of evaluation? Certain things have to be kept in mind, okay, while evaluating a scan. So it is important to evaluate all the structures imaged. It is critical to evaluate the imaged volume systematically in the axial, coronal, and sagittal planes. The anatomic structures must be identified, and where applicable, the symmetry and continuity of the bony outlines are assessed. CBCT images are displayed as multiplanar reconstructions of the image structures in the orthogonal planes. For ease of visualization, the imaged volume may have to be reoriented, for example, to align the MSP to correct for any slight positioning errors during image acquisition. This is particularly important when examining for symmetry for the structures or symmetry of the structures. It is useful to reorient the axial plane to facilitate viewing the Frankfurt plane when examining the skull base or parallel to the occlusal plane when examining the dentoalveolar arches. So depending on the diagnostic task, it may be necessary to make additional custom reconstructions in specific planes, such as cross sections, to evaluate the teeth and dentoalveolar ridges. Okay, so these were the basic principles or the general rules for evaluating a CBCT scan. So now let us go into heading wise, okay, and the theory associated with that, what you need to know before going into the scan and identifying those structures. Okay, so first coming to teeth and supporting structures. So here the detailed anatomy of the teeth and the supporting periodontium is best depicted on limited field of view scans, FOV scans. The teeth demonstrate radiopaque enamel cap, a homogeneously opaque dentin, and radiolucent pulp chambers and pulp canals. CBCT scans provide 3D information. They portray the morphology of the roots, pulp chambers, and pulp canals more accurately than the IOPA. Now, coming to this diagrams or the radiographic images, if you can see the first image over here, this is an axial section of the arch. Okay, this black arrows are denoting what over here is that the root canals or the pulp canals, how many are there? We are able to see all the canals here. Can you make it out? This one, this one. Okay, so this is how the teeth can be visualized. Whereas on the right hand side, you have the coronal section. Okay, here you are able to see the pulp morphology and the alveolar bone over here and all these things. Similar to this, the left hand side image is that of an IOPA, but on a CBCT it appears more in detail like this. Okay, here you can see a root canal treated tooth. Okay, but all you are able to appreciate is the radiopacity, which is a dense part here. But whereas if you can see it in a CBCT slice section, you can see that there is an improper obturation of the root canal and there is a dilacerated root over here, and this is the alveolar bone. So this much of details can be studied on a CBCT section. Okay, now a pulp canal that is not evident in perioapical radiographs owing to superimposition often can be clearly depicted on CBCT scans. CBCT imaging is particularly useful to evaluate multi-rooted teeth and roots with multiple pulp canals. The number and morphology of the pulp canals and their course through the roots in all three planes can be examined. Okay, for example, this one. Okay, you can see that how much of the canals are there. Okay, the roots, the canals, and the same thing in this section also. Okay, this is the axial section, this is the coronal section. So for multi-rooted teeth, reconstruction of the image volume along with long axis of each root may also be required. The individual canals are best identified on axial sections. Can you see this arrow mark? These are individual canals. Okay, and whereas the course of the canal through the length of the root and its exit through the apex are typically assessed on coronal and sagittal sections over here. Okay, this one. Morphological variations such as root dilacerations in the buccolingual dimension are well demonstrated. Detection of normal variations of the radicular and pulpal morphology is vital to endodontic treatment planning and pre-surgical assessment of the relationship of the roots to adjacent neurovascular structures. CBCT scans also reveal the proximity of the root surface to the cortical planes of the alveolar bone and detect anatomic variations such as fenestrations, dehiscence, defects. When viewing dentoalveolar structures, it is often useful to make cross-sectional reconstruction slices in the buccolingual direction that are parallel to the long axis of the tooth. Curved planar reforming can be used to generate a panoramic reconstruction, which also depicts the location of the individual cross-sectional slices. Okay, so that was about the teeth and the supporting structures as to what to see and what view will depict what exactly the particular finding which we want to achieve. Okay, coming to maxilla and midfacial bones. The maxilla and palatine bones form the upper jaw. The maxilla comprises a pyramidal shaped body and four processes: alveolar, palatine, zygomatic, and frontal process. The alveolar and palatine processes articulate in the midline to form the intermaxillary suture between the central incisors, best evaluated on coronal and axial sections. CBCT scans demonstrate the relationship of the molar and premolar teeth to the floor of the maxillary sinus better than periapical and panoramic radiographs. A common finding is pneumatization of the alveolar process by the maxillary sinus, which may invaginate between the tooth roots. The palatine processes are thick horizontal bony projections that form the anterior 3/4 of the hard palate and the floor of the nasal cavity. Okay, if you can see this image over here, this is the upper first molar. Okay, and this is your maxillary sinus floor. So they are very much in close approximation with the roots of this molar tooth, and this invagination is caused. Can you see? There is it is in close contact with the roots also. Okay, and if you can see, this is called as the pneumatization, and on the right you can make it out more clearly in the sagittal section as well. This is the coronal, this is the sagittal. Here you can see this premolar root, and all the white arrows are depicting the floor of the maxillary sinus, which is in close approximation or which forms a depth or a depression along the lines of the roots of this posterior teeth, that is premolar and molars. Okay, next. The integrity and symmetry of the cortical bony contour are best visualized on coronal sections. Disruption of the hard palate suggests developmental disturbances such as cleft palate. Areas of bony protuberances or tori are frequently noted, especially in the midline. Numerous nutrient canals also may be observed perforating the cortical outline of the hard palate on high resolution scans. The incisive foramen is located in the midline on the anterior aspect of the palatine process, immediately palatal to the maxillary central incisors. Within this foramen are two lateral canals, incisive canal and foramina of stencil. Foramina of Scarpa transmits the nasopalatine nerves. Size and shape of the foramens are appreciated on axial sections better. Okay, then when it comes to an evaluation of maxillary sinus, what are all the points to be kept in mind? First one, continuity of the sinus walls. Second, anterior, lateral, medial and superior walls. Third one, symmetry of the right and the left sinuses. Fourth one, zygomatic processes. Fifth one, the zygomatico-maxillary suture is visualized as a thin radiolucent jagged line in this portion of the arch. The medial and lateral pterygoid plates lie immediately posterior to the maxilla. This is best seen on coronal and axial sections. Okay, now coming to nasal cavity and the paranasal sinuses. The nasal cavity and paranasal sinuses aerate the maxillary, sphenoid, ethmoid and frontal bones. The paranasal sinuses communicate directly with or drain into the nasal cavity via ostia. The nasal cavity is divided by the nasal septum in the midline. The cribriform plate of the ethmoid bone and the ethmoidal air cells form the roof of the nasal cavity. The hard palate forms the floor. The lateral walls contain thin bony projections called conchae. The conchae plus mucosal coverings are called as turbinates. There are three nasal turbinates, superior, middle and inferior, which also define the spaces of meatus or called as meati. It's a plural form. Pneumatization of the concha is termed concha bullosa and is a common variant with a reported frequency of 14% to 53%. Okay, the paranasal sinuses consists of four pairs of air-filled cavities, maxillary, frontal, sphenoid and ethmoid air cells. Evaluation of the paranasal sinuses should include a critical examination of the following anatomic structures. Those are osteomeatal complex, frontal recess and sphenoethmoidal recess. This is the concha bullosa. Okay, this is how it is seen on a coronal section next. Okay, coming to mandible. The dentoalveolar region of the mandibular body is best evaluated along with the mandibular teeth on cross-sectional and panoramic reconstructions. The assessments include continuity and intact contours, symmetry, foraminas, integrity and density of the bone. Mandibular canal has ovoid radiolucency in cross-sectional and coronal slices. Okay, if you can see this, this is the mandibular canal. Okay, and it is as a ovoid radiolucency in cross-sectional and coronal slices. Okay, if you can see all this both the pictures are depicting the mandibular canal, and see here, this is the cross-sectional slice in which it is a ovoid radiolucency over here. Okay, next, temporomandibular joint. TMJ is the articulation between the glenoid fossa of the temporal bone and the condyle of the mandible. The glenoid fossa is a concave depression located in the squamous portion of the temporal bone. When viewing sections through the TMJ, it is useful to make custom reconstructions through the axial long axis of the condylar head. The resulting oblique sections are referred to as corrected sagittal and frontal sections. If you can see here, this is the section, okay, but we have to apply the tool of a reorientation and a reconstruction wherein we are able to view. See, this is the glenoid fossa, the articular eminence, and this is the condylar head. Okay, and depends on how much of a view is necessary, we can always do the custom reconstructions, and the reconstructed images are called as corrected images. Okay, In the sagittal view, the fossa and eminence form an inverted S shape, characteristically seen as a smooth radiopaque line, okay, over here in this area. When an asymmetry is observed, the symmetry of the entire mandible should be assessed, including the intercuspation of the teeth and any deviation of the mandible on opening. Now, coming to base of the skull. The skull base is best viewed on axial and coronal sections. To view the anatomic structures, reorientation of the CBCT volume to the Frankfurt plane is useful. The entire cranial base is evaluated for symmetry, integrity, and continuity. The anterior cranial base is best visualized on coronal and sagittal sections. The middle cranial base is viewed best on coronal and sagittal sections. Okay. There are several key communications between the middle cranial fossa and the extracranial space. They are superior orbital fissure, foramen rotundum, foramen ovale, and foramen spinosum. The region of the pterygopalatine fossa is also evaluated. Okay. And here, this is an airway. Okay, this is a sagittal view in which you are able to see the nasopharynx, oropharynx, and hypopharynx. They are air spaces. Okay, fine. So that completes what exactly you have to see for the anatomy and what are the sections useful for it. And we have learnt it under different headings. Okay, now coming to MCQs. Okay, the first 10 MCQs will be question answer based. The remaining are how do we learn to identify? Okay, coming to first MCQ. Which of the following is true about CBCT scans? The answer is D, that is all of the above. So first one, the individual canals are best identified on axial sections, whereas course of the canal through the length of the root and its exit through the apex are typically assessed on coronal and sagittal, correct? Second one, morphological variations such as root dilacerations in the buccolingual dimension. C. Proximity of root surface to cortical plates of alveolar bone and anatomic variations such as fenestrations or dehiscence effects. All of the above can be seen on a CBCT scan. So, answer for first MCQ is D. Second one, involvement of the pterygoid plates is an essential feature of. The answer is A. Leafort fractures. Third question, which is the false statement about frontal sinuses? That is, the frontal sinuses are the last paranasal sinuses to develop. They are correct. Second one, they usually start developing at approximately 6 to 7 years of age. Correct. They are typically symmetric. That is the wrong option. Okay, they are the least symmetric. And D, hypoplasia of frontal sinus common normal variant, and aplasia of frontal sinus is noted in approximately 4% of the population is also correct. So what is false about it? Option is C. Okay, then fourth one, osteomeatal complex is best visualized on. Answer is A, the coronal and axial sections. Fifth one, which is the true statement about sphenoethmoidal recess? Answer is all of the above. Okay, this is the drainage path for sphenoid sinus and posterior ethmoidal air cells in the superior meatus at the posterior region of nasal cavity. Correct. This recess is located between the posterior ethmoidal cells and the sphenoid sinus. Correct. It is best appreciated in axial and sagittal sections. So all of the above are correct. So answer is D for fifth question. Sixth question, the spheno-occipital synchondrosis is completed by 16 to 20 years. Option is A. Seventh one, which is the false statement about foramen rotundum? That is D. The course of this canal is best visualized on sagittal sections. Then next one, pterygopalatine fossa. Okay. On sagittal sections is seen as an inverted pear-shaped radiolucency. On axial and coronal appears as rectangular shaped area. C is the correct answer because both the statements A and B are true. Ninth question, corticated appearance of the articular surfaces of the condyle and glenoid fossa and articular eminence is seen in. Answer is C, after approximately 18 years of age. Then 10th question, superior orbital fissure. Okay, they transmit cranial nerves 3, 4, 5 and 6 and the superior ophthalmic vein. So answer is A. Okay. So now we'll go to section wise, okay? And the key of this, I will be sharing it after we have completed all the lectures, okay, of part 1 radiology. Why I have included this is that, see, whenever you have to keep two things in mind. One is axial, coronal, and sagittal sections. You are supposed to be thorough with what each looks like. Okay. Point number 2 is that you must always know that a CBCT, whenever you are shooting the scan, it comes in different levels. Okay. And there are the scrolling option, which I had taught you in the previous class. The scrolling is basically done to shift it. Just imagine you are holding a skull, okay, and you are just rotating the skull in your hand. Similar thing happens to a CBCT scan. Here also, before we proceed to the MCQ, let me show you from figure A to E. Okay, prior to that, you look at the skull over here. There is something written as A, B, C, D, E over here. What does that mean? It is the level, okay, it is the plane level at which the scan is there. Okay, this is the first level, that is A. So here you are seeing like this, and then you tilt the skull little bit, you are able to see more structures here, little more here and here. Okay, so this is how a CBCT has to be visualized. All right, so here in this, okay, look at the diagram properly. Okay, here we will be discussing each thing A, B, C, D, E. Okay, the questions are: identify the section of the CBCT. What section is this? It is an axial section. So your answer for 11th question will be A. Second, 12th question. What do A, B, C, D, and E represents? They are B, that is levels of reorientation, what we are doing. Okay, then in figure A, identify label number 4. Okay, let's go to this first image, label number 4. Now imagine you are holding a skull, the skull base, and you are just like, turning it around. From the axial, what are you able to see over here? The answer will be C, that is squamous portion of temporal bone. Okay, then in figure B, identify the label 7. Okay, identify the label 7. What does 7 depict over here? This is the temporal bone. What comes before that? Sphenoid bone, right? So this is the greater wing of the sphenoid bone. So you have to identify it in that way. You must know first, always draw a imaginary midline and then visualize the structures on both the right side and the left side of the scan, and then one by one you can go from front to last. You can just visualize that what are all the anatomic structures which are lying over there. It will become easy for you to identify. Okay, here compared to the first one, if you can see over here, you still have the squamous portion of temporal bone. What lies ahead of that, or what lies before that, in if you see from the front, that is the sphenoid bone. Sphenoid bone has what? Greater wing and the lesser wing. So this is the greater wing of the sphenoid bone. So option will be A. Okay, for 14th question. Now coming to 15th question, in figure C, identify the label 8. Okay, coming to C, there is a 8 over here. Okay, what is the difference between B and C now? We have rotated or reoriented the axial image little bit more. So you are able to see more sections over here, right? So here, what is this? This radio opacity over here, it is nothing but your nasal bone. Okay, the nose bone. So your option is B, nasal bone. Okay, then coming to D. In figure D, identify label 18. Okay, what is 18 over here? You have the, go back to the diagram. In level D, they are asking for 18. Okay, what happens in this area? Okay, just imagine there is a nasal cavity, there is a nasal spine, and behind that inner axial section, what are you able to see? It will give rise to the maxillary sinus, sphenoid sinus, and other things. So you have to analyze it in that way. So here Number 18 denotes your sphenoidal sinus. So answer is C. Okay. Then next E. Um, in figure E, identify label 23. Okay, what is the 23 over here? If you can see over here. Okay, now if you can see, there is this nasal cavity is there. Okay, then you are able to see all the sinuses also clearly. Okay, then 22. Anterior cranial fossa, when you tilt it slowly, what comes next? You have the middle cranial fossa, right? So here 23 is actually depicting your um, 23 is actually depicting your um, middle cranial fossa. Okay, so that is the answer. 17th one, your answer is D. Okay, so I hope you understood like how you have to see the scan section. What you have to keep in mind, draw a imaginary bisector, or that is a midline, and then visualize both the structures on the right and the left. Always visualize or start thinking about the structures lying from anterior to posterior, so that when you are actually scrolling through the scans, it will become very obvious that this structure lies behind this behind this, like that. Okay, you have to do it in a very systematic way. All right. Now, the second section. Okay, here, if you can see A, B, C, D, E have come a little bit down, right? Earlier, it was little up. Now we have made it little down. Okay, here. That is the next level. We are reaching the mid-cranial fossa. Fine. So, you have a look at the diagram from A, B, C, D, E. Okay, more we go into the scans, the more structures we are able to visualize. Okay, so we are going into the middle cranial fossa or the mid cranial fossa structures. Now the questions will be, in figure A, identify label number 9. Okay, now, what is label number 9? You can see over here, what is the structure which is lying over here in the midcranial fossa? That this is nothing but your greater wing of sphenoid again. This is the sphenoid sinus. The pair of sinus is here. And what sphenoid sinus come from where? The sphenoid bone, greater and lesser wings. Okay, it is a three-dimensional structure. So, number 9 will be what? Over here, it will be greater wing of the sphenoid bone is your answer. Okay, so that is option number A for 18th question. Now coming to the next question in figure B, identify label 18. Okay, now what is 18? Let us go into this. I will teach you in B. Okay, 18th number is this one. So when you rotate the scan or when you reorient the scan, as your anterior structures keep going forward, what exactly is coming? You are reaching the mandibular part, right, or the TMJ part. So what can be this structure? It is nothing but your glenoid fossa, okay, where the TMJ, the condylar head is going and articulating over there. So 18 over here represents the glenoid fossa. So 19th question answer is A. Okay. Then coming to the next question. In figure C, identify label 25. Okay. Coming to C, here you have 25 over here. Okay, what is this? This is the occipital bone. Okay, that is the occipit. Fine. So now where are we? We are almost near the base of the skull. Okay, it is like that. So this is the 25 number represents your occipital bone. So option is A for 20th question. Okay. Then 21st, in figure D, identify the label 27. Coming to figure D, there is 27 over here. What are these structures, by the way? This is your nose and this is your nasal spine, which is dividing the nose into right and the left. Okay, what are on the other side immediately behind that is the maxillary sinus, right? So this is a, first identify the key structure over here. This is your maxillary sinus. But what is this number 27 is denoting? Okay, 27 is nothing but the medial wall of the maxillary sinus. So 21st question answer is A. That is medial wall of maxillary sinus. Now coming to the next question, in figure E, identify the label 38. Coming to E, there is 38 over here. Now, after this reorientation, what are you able to know? This is the midcranial fossa. Anterior has disappeared here. This is midcranial. What comes in the posterior cranial fossa in this area? The major foramen through which maximum of your vessels and nerves exit, that is at the base of the skull, that is foramen magnum. Okay, this is your answer. So 22nd question answer is C, foramen magnum. Okay, I hope you are understanding. Fine. So you practice seeing more and more of the scans, plus I will be sharing the detail of the keys of these identifications as well. So please go through it repeatedly till you understand. Okay, once you understand how to view the sections, identifying the anatomic landmark in that area should not be a very tough task. Okay, so now coming to this third exercise. Here, where can you see the A, B, C, D, E in this one? It has come more down, right? So we are actually in the base of the skull area, the mandible and the base of the skull area. Okay, so we have A, B, C, D, E over here also. Now the questions will be, in figure A, identify the label 3 over here. There is 3 here. What is the label over here? 3 means what? What is here exactly? It is nothing but your maxillary tuberosity. Okay, this round part over here. So answer for 23rd question is A. Coming to 24th question, in figure B, identify the label 10. In figure B, you have 10 over here. Can you see this bony structure with a small dent like thing here? Why there is a dent formed? Because it is a soft tissue which is present over there. So what is it? It is nothing but your lingula. Okay. So 24th answer is D, lingula. Then coming to 25th question, in figure C, identify the label 13. Okay, over here there are 3 labels and they have asked what is 13. So this is the lamina of C2 vertebra. Now can you see this is the maxilla, the mandible has come over here, it is superimposed, and now this is the vertebra also in this one. So 13th is the lamina of C2. So 25th answer is A. Option is A. In 26th question, in figure D, identify the label 16. Okay. In D figure, they are asking what is 16. What is 16 over here? It is nothing but the, just imagine this is the, just think this is a mandible. And where exactly is this 16 showing? There is a dent over here, or there is a depression. Okay, meaning that there is a some radiolucent structure is there, and this is the premolar molar area. What is the foramen, or what is the radiolucent anatomic structure which passes through the premolar area? It is the mental foramen. So your answer is mental foramen for this question. Okay, 26th question answer is A, mental foramen. Now coming to 27th, in figure E, identify the label 18. Okay, in figure E, identify the label of 18. So what exactly is this structure over here? This is your hyoid bone. Okay, this is coming below the neck region. Okay, that is below the mandible region. So here 18 denotes hyoid bone. Okay, so the answer for 27 is A. Fine. Now coming to this. So what kind of a section it is? Your first question is that identify the section. This is a coronal section. Okay, this is a coronal section. So answer should be coronal. You can mention it, or in the MCQ if they asked one among the 4 answers, you always have to select the coronal for this type of images. So here also we have the ABCDE which is lined up over here, the level of the orientation of the planes. Fine. So the question will be, in figure A, identify the label 6. Okay. Identify label 6 in figure A. So where is 6? 6 is over here. So that is nothing but your inferior nasal turbinate. Can you see this one? The inverted L shaped inside the radiolucency. So this part is the terminate. So the turbinate. So this is the inferior nasal turbinate. So answer for 29th question is A. Fine. Then 30th question. In figure B, identify the label 10. Over here, this is the what is 10 over here? If you can see it in this section, what exactly are these paired structures on the either side of the nose? Maxillary sinus. Okay, so the answer is maxillary sinus. So option D is the correct answer for 30th question. Okay, coming to 31st question. In figure C, identify the label 13 over here. 13 number they are asking, what is this? So what is 13 over here? What exactly is happening? Nose, above that what comes? What are the other paired structures about the nose? It is the orbit, right? So this one is the orbit. Okay, so 13th, that is 31st question, option is A, orbit. 32nd question, in figure D, identify the label 6. Here, D, okay, label 6. They are just showing it this way. Okay, what is 6? It is the inferior nasal turbinate again, but in a different section. Okay, you are able to see it or visualize it more clearly. So option for 32 is A. Then 33rd question, in figure E, identify the label 24. In figure E, can you see this? Over here there are a lot of structures. So 24 they are asking, what is the 24? This is nothing but the frontal sinus recess. Okay, it is a bony protuberance here. So answer for 33rd question is A. That is frontal recess. Okay. Now coming to the next identification exercise. Can you see there is a movement of this ABCDE planes little posteriorly? So now we'll be visualizing the structures in this area. Okay. The questions are, in figure A, identify the label 4. So here, where is 4? This is the fourth one. Okay, what is this? You have the nose, you have the nasal septum here. It is divided into right and left. These are the paired cavities. Maxillary sinus are there. What can come behind it? What can be possible? Okay, that is nothing but the zygomatic arch. Okay, they are appearing as this radiopacity on both sides, and always look for structures which are parallel, or make a list and learn structures which are parallel or structures which occur single. Okay, it will be more easy for you to identify such things. So here option for 34th question will be B. It is a zygomatic arch. Okay, 35th, in figure B, identify the label 13. In figure B, we just have to see what is 13 over here. What is 13 here? There is a radiolucency inverted pear shape. What is an inverted pear shape radiolucency in a coronal section? It is your mandibular canal. Okay, so this 13 is mandibular canal. So option for 35th is A, that is mandibular canal. 36th, in figure C, identify the label 17. In figure C, there is a 17 which is given over here. What is this? It is lying behind the nasal cavity, right? So what is 17? It is your medial pterygoid plate. Okay. So answer for 36th question is B, medial pterygoid plate. Then next question, 37. In figure D, identify the label 16. Okay, figure D. Come to figure D. Where is 16 here? This is 16. So what can be 16? What is the structure here? If this is the medial pterygoid plate, what is this one? It is away from the midline, lateral pterygoid plate. Okay, the option is for 37th question, option is A, lateral pterygoid plate. Then coming to next question, that is in figure E, identify the label 28. Okay, which is figure E, this one. And 28, they are asking what is in this place. Okay, when you tilt the scan little more, what are you able to visualize? What are these holes over here or the radiolucency? They are all foramens, right? So what lies at this level? It is your foramen ovale. Okay, so option for 38th question is B, foramen ovale. Now, coming to the next identification exercise, this is also your coronal plane only. Okay, so here in figure A, identify the label 7. So here also you can see this A, B, C, D, E planes have moved little more posteriorly. We are visualizing that particular section. Okay, so what was the question? In figure A, identify the label 7. So what is label 7 here in this place? What are you able to see in this area? It is the styloid process, okay, over here. Okay, so option for 39th is B, styloid process. Next question, in figure B, identify the label 12. That is over here you are able to see the back, right? The back of the skull, the near to the vertebra. Okay, so here they are asking for label 12. So here this is nothing but your vertebra, right? So this is the odontoid process of C2 vertebra. Okay, you are able to see it in a coronal section in this one. So option for 40th question is B, that is odontoid process of C2. Okay, then coming to in figure C, 41st question, in figure C, identify the label 18. That is over here. This 18 they are asking. Okay, 18 means what? What is the foramen which passes through this one? Is your jugular foramen that carries the jugular nerves and vessels. So this is the jugular foramen. So option for 41st question is A. Okay, jugular foramen. In figure D, identify the label 16. That is coming to the figure D, identify label 16. Here, when you are able to see from the back, what is the most farthest from the midline, the sinuses which are placed? That is the mastoid sinus, and that is formed of mastoid air cells, right? So these irregular radio opacity and radiolucency here represent the mastoid air cells. Okay, so option for 42 is C. 42nd question will be C, mastoid air cells. Then 43rd question, in figure E, identify the level label 22. Okay, so coming to E, okay, 22, they are asking what is this one? Okay, so here in 22 it is nothing but the foramen magnum. We have come to the base of the skull, okay, and near to the vertebra. So it is 22 represents the foramen magnum. Okay, so 43rd question option is A, that is foramen magnum. Fine. Now coming to the next one. All right. So what section is this? Identify the section. This is your sagittal section. Okay, you can note it down. Now, what are the questions in this? In figure A, identify the label 2. That is over here. What is this one? That is option will be B. That is frontal sinus. Okay. The next one. In figure B, identify the label 17. In figure B, come to figure B and identify what is 17 over here. That is the anterior arch of C1 vertebrae. Okay, so 46th question answer is A. Then 47th question, in figure C, identify the label 23. In figure C, where is 23? This one, it is branched out here, right? So what is 23 in this? This is nothing but your ethmoid air cells. Okay, so the option for 47 will be A. All right, then next one, in figure D, identify the label 34. In figure D, coming to figure D, identify 34. What is being given as 34 here? This is the pterygopalatine fossa. Okay, so the answer for 48 will be B. And next question, in figure E, identify the label 37. That is if this is 37, what is the structure which is lying over here? This is the mastoid process. Okay, so option for 49 is A. Fine. Then coming to the last one, how to identify this one. I think the key is also mentioned in this itself. Okay, so coming to the section, this section is called as the cross-sectional view. Okay, so you can mention as cross-sectional slice of a CBCT. So in figure A, identify the label. Okay, what is this one over here? If you can see something as a cross sectional like this, okay, you can actually make out, even if this label was not there, it would have been easy for you to know what is this projection, what are the bony projections in the anterior mandible which come in that area. That is the genial tubercle. Okay, so A is genial tubercle. Then in figure B, identify the label. What is this one over here? It is the lingual foramen. Okay, can you see this radiolucent line over here represented by 2? It is your lingual foramen. Now in figure C, identify the labels 3 and 4. What is 3 and what is 4? 3 is this is the premolar area. First check for the area. 3 is mental foramen and 4 is the inferior alveolar canal. Okay, this happens in the premolar to molar region. So both A and B are the correct answer. So answer is C for 53. Okay, then next one. In figure D, identify the labels 4, 5 and 6. Mandibular canal, submandibular fossa, inferior border of the mandible, all of the above. If you can see here, 4, 5, 6. Okay, fourth one is the inferior alveolar canal over here, the round or the oval radiolucency. Fifth one is the submandibular fossa in this region. And sixth one is the inferior border of the mandible in this cross-sectional image. So all of the above are the answer. So 54th option is D. Okay, coming to 55th question. In figure E, identify the label 4 and 6. Mandibular canal and inferior border of the mandible. This is one more slice over here. This is the oval shape radiolucency, mandibular canal, and this is the inferior border of the mandible. So this is 4 and 6. Both A and B are the options. So option for 55th question is C. Okay. Then 56. Last question in figure F. Identify the label. Okay. This one. So what is this? This is a soft tissue. The seventh one over here, that is the lingula and mandibular foramen as seen from a cross sectional. As you scroll it, it gives this kind of a effect. If you can practically do, if you have access to a CBCT scan, you'll be able to learn much better. Okay. So 56th answer is lingula. Okay. That is the label over here. Okay. And mandibular foramen is also there. Okay, so that completes our CBCT anatomy in all 3 sections. I hope you have understood and you enjoyed learning how to identify. Okay, the key will be shared in detail to you. Okay, so for this class, thank you so much. And our next topic will be on other imaging modalities, where we will be learning the basics of CT, MRI and other imaging and the MCQs related to that. Okay, so this completes our CBCT basics also. Okay, the further class timing will be notified to you. Till then, please practice these sections, and I shall be sharing the key with you once part 1 is completed or in the final chapter. Okay, thank you so much. Wish you all the best.